Hi there, and welcome to the Compassion Fatigue Podcast. I'm your host, Jennifer Blau. You're listening to Session 20. My guest today is Dr. Sally Nazari. She is a New York-based licensed clinical psychologist and Reiki master teacher. Sally is passionate about helping people eliminate pain and fear from their lives and building a life they want to celebrate. Her therapeutic approach is to provide support and helpful feedback to assist people in effectively addressing personal life challenges. She integrates complementary methodologies and techniques along with scientifically sound methods to offer a highly personalized approach which is tailored to each client. Trained as an integrationist, Sally is an interactive, solution-focused licensed psychologist who also provides Reiki healing sessions. Reiki has been valued as a complement to psychotherapy, as well as in alleviating depression, anxiety, the effects of trauma, and reducing stress. Sally is also well published in high-caliber peer-reviewed journals and has been sought out to provide professional presentations at international conferences as well as within the community. In fact, bringing greater understanding to her community is what compelled Sally to launch her brand new podcast, Beyond the Couch. Sally is here today to talk about Reiki therapy and how it can help to reduce stress, as well as help with some of the symptoms of compassion fatigue and burnout. Ladies and gentlemen, please welcome Dr. Sally Nazari. Hi, Sally. Welcome to the Compassion Fatigue Podcast. How are you?
Hi, Jen. I'm good. I'm very excited to be here.
Yeah, I'm very excited to bring this topic to our listeners. I think a lot of our audience, well, if they're like me, they're really in tune with nature, animals, nature. And with that, I think brings a certain kind of open-mindedness. And this is a complementary type of therapy that I think I've always really had an interest in. And I'm really looking forward to finding out more about it. And it is Reiki. So, Sally, can you tell us what exactly is Reiki?
Well, Reiki therapy is a holistic and gentle energy work process that assists us in physical, mental, and emotional healing. It's a simple and safe energy balancing technique that benefits everyone who receives it because when our energy is balanced and flowing, self-healing and positive transformation can happen naturally. Reiki works on the physical, emotional, and mental levels to release the energy blockages that create dis-ease. So the difficult experiences that we're having are brought on by those blockages. And a Reiki session can help ease tension and stress, and it can help support the body to facilitate an environment for healing on each of these levels, the physical, mental, and emotional.
Yeah, because, so many of my audience members who are working in this, in animal welfare, animal care, or animal rights, they really deal with a lot of traumatic situations. They're exposed to a lot of abuse and neglect type of situations. And so I think that what we know about trauma is that the body really does hold on to trauma.
Absolutely, yes.
And so, in addition to being a psychologist, you're also what's considered a Reiki master. What led you to this practice?
Well, I was first exposed to Reiki as a graduate student while I was looking for a way of relieving stress, sort of on the heels of what you just mentioned about trauma and how we hold it in our bodies. Because of the pace and demands, as passionate as I was about what I was learning and experiencing, I needed something to really target that mind-body effect of stress. After doing some mindfulness practices, I really came to notice that I held my stress and tension in my body, and it was taking a toll on me. I'd heard about the way Reiki sessions promoted relaxation just through the experience of being in the session, and I became curious. Once I learned more about it, I was impressed with the balancing nature, how gentle yet effective it was, the accessibility of remote sessions, and also by the fact that at that time, studies were just beginning to show positive effects as well. So once I learned that Reiki healing could be beneficial for animals, I knew I wanted to train and offer it to the community. And while I was training, I kept wanting to progress so that I could offer not just the healing sessions, but also the teachings and the attunement ceremonies that allow someone to become a practitioner. And this way it could become even more accessible.
And so are there different kinds of Reiki? Kind of take me through, what a session looks like and if there are different types of this practice.
Jen, that's a really important question. So, while the Reiki energy that's crucial in Reiki sessions is one and the same, there are different branches or lineages of Reiki practice for treatment sessions. So, to put it simply, because the Reiki teachings were disseminated, then spread throughout the world, a variety of methods for delivery were cultivated. Much like the game of telephone, certain details and elements were modified or omitted as it was handed down. And one reason for this is that teaching Reiki in different ways within different cultures made a lot of sense. But because of that, there are now about 10 different styles of mainstream Reiki, which is generally referred to as Western Reiki, and then other smaller offshoots as well. The most common one of those is the Usui Shiki Reiki Ryoho method. And I'll talk about what a session with that looks like in just a moment. But with all of that said, there's also a lineage of Reiki that kept the original teachings intact that's called Jikiden Reiki. Jikiden Reiki is less commonly known, and it's often thought of as more true to the original style of practice for Reiki. But typically, what we can expect today in a Reiki session is that we'll initially sit down with the practitioner and talk a little bit about what's going on for us that brings us in, and then we can expect to either sit comfortably or lay down in a massage table. I use a zero gravity chair and only take off our shoes. And what we'll see in the Western Reiki styles are a series of specific standard hand positions traveling around the body. And most often, a Reiki practitioner's hands will hover a couple inches away from a person's body. But in Jikiden Reiki, there's only one hand position throughout the whole treatment session. And session treatments are typically 60 to 90 minutes long.
Okay, so this is not like massage where it's more hands-on. It's like you said, it's several inches above the body.
Generally, yes.
Okay, and so let's talk a little bit about some physical and mental health benefits of Reiki because what I understand, like you said, it's a holistic type practice, so it incorporates both body and mind, right?
Absolutely. I often describe Reiki treatment as analogous to radio or Wi Fi waves. Our bodies are created by many things, as we all know, and each of those things has an electrical frequency, much like radio and Wi Fi waves do. The waves are always around us, yet we need to be tuned into the right station or network in order for the radio station or internet to work. Now, Reiki is much the same. The energy is always around, but accessing it requires a specific attunement ceremony. With that said, several studies have started to show that there are positive and beneficial results with Reiki, and it's now being offered in hospitals and other clinical settings to help, for example, cardiac patients following heart attacks, cancer survivors during their recovery, and many other conditions. And in fact, Reiki is the healing method that Dr. Oz introduced into the operating room at Presbyterian Medical Center in New York City during open heart and heart transplant surgeries. He was exposed to it because his wife is a Reiki master. Now, it's also been valued as a complement to psychotherapy in alleviating depression, anxiety, the effects of trauma, and reducing stress. All of those different things have a mind body connection as well. We feel it in our body and we feel it in our psyche. The relaxing, soothing, and healing environment that Reiki provides can contribute to comfort and peace so that our natural healing mechanisms can be supported. So, some other more specific benefits include things like stress reduction, insomnia, fatigue, work and career issues, weight loss, addiction and recovery, managing chronic illness, and even shortening the healing time from a physical injury or surgery.
And so, Reiki sounds, I'm sure to some people a little woo-woo, right? But from what you're saying, this has got some scientific backing.
Absolutely. It's been very fortunate the last couple of years that we've been able to establish a little bit of a scientific underpinning to show that there are benefits, that it's not just a placebo effect that we're seeing. It's not magic that's being witnessed.
So, yeah, now I want to dive a little bit deeper into some of these symptoms of compassion fatigue that maybe Reiki could help with. So, you mentioned this. Let's take a look at a very common symptom, depression. How exactly does Reiki help with that?
Well, I want to start looking at that by sharing that according to a study published in Alternate Therapies in Health and Medicine, patients who received regular Reiki treatments showed a significant reduction in the symptoms of psychological distress and depression. And this symptom reduction continued for 1 year after the treatment was completed. And another important study to take a look at is one conducted by the Center for Reiki Research, exploring what they called burnout syndrome, which was characterized by exhaustion and emotional issues. In their work, Reiki was shown to reduce something referred to as the sympathetic autonomic stimulation, which is a big factor in the fight or flight response, and it produced a significant relaxation response among the people they had diagnosed with burnout syndrome. Now, the way that this works is that Reiki helps to restore a person's overall sense of balance, both in the mind and the body. This may help to improve the person's mood and help them to overcome feelings of guilt or sadness that typically accompany depression and are often seen, like you said, in compassion fatigue.
Yeah, especially that guilt. That's really prevalent in the work that we do. So you touched on this, but how does Reiki help with anxiety and stress? Stress is just so inherent in the work that we do. And I think a little bit of anxiety as well. How can Reiki help with those?
Absolutely. Well, like we mentioned a couple minutes ago, Reiki helps to slow down the sympathetic autonomic system. And this is the system that's activated when we experience anxiety and stress. It's the primary mechanism in the fight or flight response. While the fight or flight response is valuable for us in the instant of a major stressor, over a prolonged period of time, it begins to weaken us emotionally and physically. This then makes us much more vulnerable to the negative impact of stress, anxiety. And when we slow this mechanism down, our physiological response to stress and anxiety begin to subside as well and provide us relief. Now, in the Reiki mindset, there is a mind body component to any kind of ailment, whether it's physical or emotional. And in this case, there's an element of both present. So, Reiki works to restore the balance and harmony in both the emotional and physical body, which can help us get back on track. The sessions give us a relaxing, soothing, and healing environment that ensures comfort and peace while our body is going through this natural healing process.
And so, I know with typical psychotherapy, we generally like to start off seeing clients once a week. How does Reiki work? Is that something that people need to come in once a week for, once a month? Does it vary?
It does vary, and that's a really important question. One of the ways that it varies is dependent on what a person is experiencing and the severity. Another reason it could vary is also just the practical and logistics of scheduling, right? So typically, in ideal situations, Reiki would be recommended 3 days in a row and possibly a fourth day. Most often, it's now done once or twice a week. 3 sessions is the most common. Fourth sessions are also pretty common, but generally there's sort of a touching base right after that third session to see if a fourth session is necessary. After that, periodically, every couple of weeks or as needed, Reiki is recommended.
Okay, so you wouldn't do it 3 to 4 times every single week.
No, no. That initial period when someone's just sort of at the peak of the difficulties, they're most anxious, they're most stressed, or they're most depressed, you might want to go in a couple of times with pretty frequent intervals. So maybe once or twice a week for 3 or 4 sessions. And then after that, they could be spaced out a little bit further.
Okay, yeah, that makes a lot of sense. And so I understand that Reiki can also help with two other symptoms that are really, really common with compassion fatigue, and that is both insomnia and then fatigue.
That's very true. Often, insomnia and fatigue come about as a result of something else going on. For some, it's stress, others, anxiety, and we also often see it with depression and PTSD, for example, all which overlap with compassion fatigue. And in most cases, fatigue and insomnia tend to have an underpinning that indicates some kind of disharmony. Because Reiki works to restore balance by clearing away energetic or electrical blockages that get in the way of this harmony, it works to address the root cause of insomnia and fatigue.
Okay, and so you mentioned PTSD, and we talked a little bit about this earlier, how animal caregivers and workers are so often exposed to so much what we call secondary or vicarious trauma. And so it sounds like Reiki could really be beneficial for helping to maybe process or deal with those traumas.
I would agree with that, absolutely. An experience of trauma really takes the toll on us, particularly when it's secondary trauma where there might be a greater sense of powerlessness and horror. And in addition to the ways that Reiki can help to contribute to that greater sense of relief from the sadness and pain in secondary trauma and the stress and anxiety that accompany it, Reiki can help us stay more resilient when we are met with difficult situations and to also bounce back from them more readily and more quickly. Now, another way that Reiki can help is that it can help us remain focused and think clearly, which can help to navigate a difficult situation with more ease and set into motion factors that can bring on a better outcome. That on its own helps to cultivate a sense of empowerment and control, which can really aid in combating secondary trauma.
And I think that's what self-care is really all about. Really, it's building that resiliency. So when you encounter these stressors and these traumas, you feel stronger and are better equipped to handle it, right?
I would definitely say so, yes.
And so would you recommend Reiki as like a standalone therapy, or is it really a complementary therapy? Like, should Reiki be done in, addition to other things such as a psychotherapy?
That's a really important question, Jen. I'm glad you asked that. In general, this balancing technique is a wonderful addition to any health program and can be used alongside other complementary therapies and conventional medicine, including psychotherapy. Now, it's important to note that Reiki is not a replacement for appropriate medical care, of course. Instead, it supports medical care by accelerating the self healing, reducing pain or discomfort, and stimulating our body's healing process. That said, if all we're looking for is stress reduction, relaxation, and preventative wellness, Reiki can be a beautiful self care practice on its own.
So it sounds like if there's something a little bit more serious, such as some unresolved trauma, or maybe even some chronic type of exposure to these type of situations, it should really be almost a complement to the psychotherapy.
Yes, I think that describes it well.
Okay, and so how can people go about finding a Reiki practitioner, and what are some of the things that they should look for in a clinician?
The International Association for Reiki Practitioners, or IARP, offers a directory for practitioners and has a code of ethics that all practitioners listed in their directory must abide by. People can check the directory for local Reiki practitioners and masters in their area, or since Reiki can be provided remotely, someone they feel comfortable with from the directory. Now, in selecting a practitioner, it's important to make sure that whoever they select has adequate credentials. So make sure that the practitioner you select is certified at level 2 or Okuden levels or higher, which means that they've been trained to provide Reiki treatment sessions to the public. Another thing for people to look for is someone who's willing to answer their questions, explain the format and structure of a session, and who takes the time to speak with them about their specific goals in seeking Reiki treatment and tailors the treatment sessions for their needs.
Okay, that makes a lot of sense. Sally, is there anything else that you'd like our listeners to know about Reiki?
I think one thing that I'd like to highlight about Reiki in particular, with regard to our discussion of compassion fatigue and working with animals, is that Reiki can easily be a tool to help comfort and soothe animals as well, and is now offered by many veterinary hospitals and clinics as an adjunct to healing. In fact, the Reiki benefits to animals are the same, and often animals respond more readily and more quickly to it. So, knowing this, sometimes it can help to offset the traumas that animal welfare workers encounter that can leave us feeling powerless and helpless, like you and I were talking about. Workers might feel at a loss as to any other means of helping animals, but they may be able to access Reiki healing sessions to provide some kind of relief for the animals they're working with, in addition to providing self care to help with those difficult feelings that compassion fatigue can bring on.
Yeah, that's really interesting. I have heard of massage for animals, but I was unaware that, and of course it makes sense that, we can perform Reiki on an animal. And so that just opens up a whole new kind of level of care for animals. And so I really appreciate you mentioning that. That's cool.
I think it's pretty cool too. Like I said, it was sort of the tipping scale for me when I found that out.
Yeah, so Sally, how can people learn more about you and your practice?
The best way to learn more about my practice is through my website at www.drsallynazari.com, where you can read more about my background and services, but also find easy access to my weekly blog, podcasts, social media connections, and just stay connected.
Fantastic. And for those of you who are currently out and about, I will put all those links up on our show notes page at the compassionfatiguepodcast.com so you can find out more about Sally and all those great resources that she has to offer. Sally, thank you so much for taking this time to be with us today. I really appreciate it.
It's been such a pleasure, Jen.
Take care.
Bye bye.
Thank you so much for listening to the Compassion Fatigue podcast. Please head on over to iTunes and subscribe so you never miss a single episode. And don't forget to check out the compassionfatiguepodcast.com for more great resources, including a link for you to join our private Facebook group where you can connect with other listeners. Please note that this podcast is not meant to provide medical advice or substitute for psychological care. Please consult with a mental health professional if you need additional support. And if you are feeling suicidal, please go to your nearest emergency room or call 911.